So good afternoon, you guys. This is my presentation on my Carolina Health Informatics internship. So I'm just kind of doing my final deliverable here. But thank you all for attending, and I hope that you're having a great afternoon. So here's just a little brief agenda that I had laid out for today. This basically just is going to kind of run through a brief overview of the things that I'm going to discuss. I'm going to introduce myself a little bit, just so you can have some background information as to who I am and what led me to the internship that I chose. Talk a little bit about the internship that I completed, and then discuss the topics which have to do with my internship, go into my final deliverable that I made, the future avenues for perinatal research, concluding thoughts, acknowledgements, thanks, questions, and then that will be all. So a brief introduction into myself. My name is Haki Bradley once again. I have my Bachelor of Science degree in pre-medicine biology with a minor in chemistry from Western Carolina University. And right now I am, of course, working on my Master of Professional Science in Biomedical and Health Informatics here at University of North Carolina at Chapel Hill. I was a senator for the UNC Graduate Professional Student Government for the Biomedical and Health Informatics program, co-founder of the Health Informatics Student Association, and I'm currently employed as a molecular oncology technologist for LabCorp. I included this information to kind of just give some precursor as to who I am. That information, I guess, just kind of shows that I have a health background and not really necessarily a information science background, but that's the gap that we're bridging here in informatics. So I think that's important to kind of just put out there and state, but also once again, give you an introduction as to why I chose the internship that I did, which leads me here to my internship. So I will get into that now. So I completed an internship that might be a little bit different from my peers. It was a research-based internship with the Perinatal Research Service Center here at UNC. I completed it with Randall Blanco, who was actually the co-director of the Perinatal Research Service Center. So it actually consisted of myself with 9 other fellow biomedical and health informatics students. And this was an internship that we all kind of did together. And it consisted of, on this slide, I'll kind of get into that, researching 4 topics of our own choosing, and then completing 6 literature reviews on each topic. We will present a summary of each of those topics to the internship cohort. And that would kind of sum up the first portion of our internship. And then we were to complete a final deliverable. And then we presented that to the group as well. So this was just kind of what an overall bird's eye view of what I did, who it was with. And then I'll kind of get into now the topics that I chose. So as I mentioned, we were to choose 4 topics, and I chose these topics here. Excuse me. The first was neurodevelopmental immune benefits, advantages of lactation, chronic gestational preeclampsia, hypertension and pregnancy, ectopic pregnancy, technology and its evolving impact on pregnancy. So these were my 4 topics here that I decided to go with that were of interest to me. And yeah. So I'll kind of do now is go through like similar to what I did during the presentations, but it'll be just an overall snapshot of what we typically would do on a week-to-week basis. We would create our topics, come in and meet and present these topics to the group. And this is my topics that I will introduce and kind of briefly discuss with you all, just so you have a glimpse of the research that I conducted and what I gathered from those. So what I did at the beginning of each of my presentations is I thought it was pertinent to just kind of say what the relevance was to the perinatal field and why I was doing this research. The perinatal field is defined as the number of weeks immediately before and after birth. So this topic of lactation, along with its benefits, directly relate to the weeks after birth and newborn nutrition. This research will assist with supplying physicians with the substantial supporting information data to confidently affirm breastfeeding's benefits. So it's just a of course, very necessary. And I'll kind of get in on the next slide of just some of the benefits that I found in doing the research. And the main things that kind of just, I guess continue from that last slide is that breastfeeding was so important because when we look at the overall health of an individual, your health starts from infancy. And that infancy, breastfeeding for 6 months exclusively, which was the time limit that they found was to be the most effective and have the most cognitive and immunal benefits. It actually would result, if babies were healthier in that time period, in a financial, I guess, retention for the government and the hospitals who are spending these dollars on health and health consequences just in the future. So that one kind of goes to the fourth bullet point that is on the current slide, and that's if 90 mothers in the US would comply with breastfeeding exclusively for 6 months, there would be an estimated savings of $15 billion per year. And then next, I would like to point out the breastfeeding initiation report for 75% of the US population there was initiation reported for 75% of the US population with socio-demographic differences. And those differences were just among race and also class. So if you were white, you were seen to have higher white and high in class, you were seen to have higher breastfeeding rate. And then just according to race, it was actually the Latinx population that had the highest initiation rate. Those factors that influenced that were just that mothers had to go back to work. It was a factor of how long could they be out of work, when they would need to go back, and just various things of those natures that kind of drove them to, even if they wanted to, because mothers stated that in these papers, they would have preferred to breastfeed for longer, than they actually had to go back to work and were not able to do so as long as they would have liked to. So just going over these, like I said, once again, briefly. So then topic number 2 was just chronic gestational preeclampsia, hypertension, and pregnancy. So hypertension and pregnancy is just, as a whole, would decrease the potential future morbidities as well as reduce the economic healthcare costs. So ultimately, understanding hypertension during pregnancy and bridging that understanding with advancements in technology could have the potential to save countless lives. So that's the just kind of relationship there to the perinatal field. Hypertension just plays such a key role in our overall health, just as individuals, but especially during pregnancy. And when you have a lot of pushing this occurring and bleeding, is something that can really just kind of impact the maternal outcome during childbirth. So the key areas of emphasis here that I wanted to point out is just that hypertensive pregnancies and preeclampsia are the leading causes of maternal death and put mothers at high risk of developing cardiovascular disease. And then down at the last bullet, one thing that's really important is that there were racial and ethnic disparities existing, requiring the need for interventions. So just among populations, it was appearing that minority populations were having higher hypertensive pregnancies than non-minority populations. So that's something that's just very alarming. And then nowadays, when we look at the overall public health of the US, but of a population in general, we want to try to correct these issues or these disparities that are going on within populations. And that's where we talk about the public health and trying to just make sure groups aren't marginalized in populations and things of that nature. So that was that one briefly, and then we're going on to topic 3, ectopic pregnancies. So ectopic pregnancies is just a type of pregnancy that is extremely rare, but it is where the pregnancy is not localized in the uterus, is actually somewhere else. So it could be in the ovary, it could be in the fallopian tube. And when that occurs, it can cause extreme pain, and it's most of the time has to be, I'll go on treatments on the next page, but they're just extremely rare. and it's essential that these are identified extremely early as possible. So ectopic pregnancies are a rare condition of pregnancy that are responsible for 2.7% of all pregnancy-related deaths. As I mentioned, the only treatment for ectopic, or one of the treatments for ectopic pregnancies is salpingectomies. There's also salpingotomies. But what that is you can have a bilateral salpingectomy, and that's a bilateral, of course, both of your fallopian tubes are removed. A salpingotomy is where those fallopian tubes are actually just repaired from where the ectopic pregnancy occurred. So as I mentioned, once again, early diagnosis is of the utmost importance. And right now there's actually the primary mode of diagnosing an ectopic pregnancy, is with the MRI technology, and they have transvaginal ultrasonography. So those are current methods that they have, but they're working to try to get these just identified as early as possible so that it can kind of be rectified and prevent, any further complications that can occur to the mother or to the unborn child. Right here, we have technology and its evolving impact on pregnancy. So this is kind of bridging that gap, as I mentioned, that healthcare is, of course, health and medicine based, and you have a lot of things that just occur there. But technology is something that's just overcoming everything. And being that that's occurring, that's what we're here now doing in biomedical and health informatics. And that's kind of figuring out how to use this technology to make healthcare smarter, essentially, and be able to have greater perinatal outcomes. So there is a plethora of technology that is out there available. But one of the things that I found in one of the articles that I read was technology colonization. That was a term that they used and they kind of coined. Technology colonization kind of refers to the idea that technology is taking over every facet of our lives that we currently have, and it's taking over the healthcare industry, whether it be EMRs, EHRs, interventions that are occurring. And not that it's necessarily taking over. One thing that it wanted to make sure was that it was referring to how it's improving the childbirthing process and just improving healthcare as in total. So that was a term that I thought was extremely interesting, and I thought it was important to put in there. And then another technology that I thought was extremely just innovative, I'm sorry about that, was preeclampsia detecting engineered device. And that was by somebody at Purdue University. So they actually created almost a cuff. And I actually have it in the next, when I get into my final deliverable, I'll be able to show it to you guys. But it's a cuff that you put on your wrist, or that females will put on their wrists when they're pregnant. And you can connect it to an app on your phone. And when you connect it to the app on your phone, it has the ability to detect preeclampsia earlier from your house, and then will actually send the results to the doctor so that you don't have to wait to be seen in order if you feel that something's off or something's wrong. They said that it was also shown to give mothers peace of mind. So that's also a key aspect that I think helps a lot of mothers during that time period when they have all of these things going on. Another thing that's key, and I think is extremely relevant in our society nowadays, is emerging health information technologies include social media, internet, websites, and mobile apps. We all have cell phones. Cell phones are just everywhere. So the information is out there. So the best thing that you can do is put information, or put the correct information, bring that information to individuals. So right here, I'll get into my final deliverable. To kind of give a little introduction to that, we were asked to do a deliverable after we had conducted our research that would just kind of serve as an infographic or something that we would present to somebody. And that's kind of the route that I took, is that I intended to make a poster that I would almost present to clinicians, and kind of with the sense of urgency of saying that hypertensive pregnancies are something that need to be corrected. They're steadily increasing over the years, and there's a demographic that is suffering at a higher rate than any other population. So this was my poster that I constructed as my final presentation or final deliverable to my cohort group. And I'll kind of go over this now. So, of course, I didn't even say the name, but of course, this is over hypertension and pregnancy, roots to preeclampsia and maternal death. So the background here, and I'll just kind of walk through it, is just that hypertensive pregnancies create numerous risks during childbirth, serving as the leading contributor to maternal mortality and morbidities. Social determinants of health illustrates how a patient's confounding factors can gradually onset conditions such as obesity and hypertension, dangerously putting aspiring mothers at risk for childbirth. And then the last one is just talking about social determinants of health, which I'll kind of get into as I go down to the next image. So I go down there to the image of the US, and we can kind of see on this heat map that the Southeast region, up from really around Texas, all the way up to Pennsylvania, Michigan, but just extremely dark states are Georgia, Alabama, Mississippi, Louisiana, North Carolina, South Carolina, these really southern states. And when you think about these states, you're thinking about the nutrition of these states, you're thinking about the southern food, the southern cooking, but also the health that's really in these populations. Some of these states are more rural. You think about somewhere Mississippi. So when you think about these areas, they're kind of, there's more room for conditions to occur. So that kind of is what that graph is there implying. And then when you go down to the next image there, the next graphic, that's a racial breakdown. And it's all of that heat map is just for the female populations by the state. And then the next one is just for the females racial breakdown. And then when you look at that, it's actually showing that the highest rate is for African-American females. The second one, which was actually surprising to me, was the American Indian Alaskan Native. So it just allows you to kind of look at this data, and that's what the good thing about what we do here with biomedical and health informatics is just taking this data and putting it on graphs, infographics, posters, so that you can actually see the data without even having to read a whole paper. So that's kind of there. And I kind of touch on what I was just saying, was just the perinatal trend of just poor nutritional habits that have increased over the years. You talk about obesity is the highest it's ever been over the years. And that trend is shown there on the top graph. And then you talk about the mortality rates have increased. Cause of pregnancy-related deaths in the US is on the second graph. And that one right there just really shows, so hypertensive disorders of pregnancy is actually the 7th one, and that accounts for 6.8. But as I mentioned in my paper earlier, or in my topic earlier on hypertensive pregnancies and heart conditions account for cardiovascular disease. So when you look at cardiovascular in the first column, that's the first leading cause. When you look at cardiomyopathy, that's the third right there. When you look at cardiovascular accidents, that's the 6th one. The 7th one is hypertensive disorders of pregnancy. So it's just all of these heart-intensive pregnancies are the main ones that are the leading causes of pregnancy-related deaths in the US. So that's just extremely, it stands out. It's alarming. It should bring extreme awareness to heart conditions during pregnancy, and it definitely needs to be addressed as early as possible. I kind of defined a couple of terms under that graph, just talking about the complications that could occur during childbirth when you have hypertension. So just the 4 of those are preeclampsia, eclampsia, superimposed preeclampsia, placental abruption, organ damage, and stroke. And then the last graphic there is just really what I was saying, and it goes back to the last picture when you talk about hypertension in the States. It just kind of follows that same trend, and that's that non-Hispanic Black women are the ones that suffer at a higher rate than any other population from maternal mortality with hypertension. So then going over here to the conclusions, excuse me, and then the conclusions here, just that unsurprisingly, female hypertension is the highest in the US among states in the Southeast region. I've kind of touched on a great deal of these, but some good ones to point out are just despite encountering complications during pregnancy, hypertensive pregnancies can result in lifelong morbidities, including chronic hypertension, cardiovascular disease, and permanent organ damage. This research focuses on maternal effects of hypertension. However, effects to babies include cesarean delivery, intrauterine growth restriction, low birth weight, preterm birth, infant death. And then the last one is just that, of course, as I mentioned, incredible differences in maternal mortality by race strongly suggest a health equity issue. And of course, here in the biomedical and health informatics program, we have the benefit of being able to take classes in the public health field. So we have the availability of being able to see, just understand what health equity means to the field. So the next thing that I have is just images there, just kind of talking about preventing hypertensive disorders in pregnancy. The last one is, of course, eating healthy. So that is, of course, the best thing that women, but people in general, can all do is just eat healthier. And then it's going to the clinician and talking out your options and discussing with them as early as possible. And the first one that I have, the reason that I started in reverse order is because the first one is that's the blood pressure cuff that can detect preeclampsia earlier that you can use from home as a monitoring device. So I just kind of wanted to show those images there of that. And it's showing the woman laying down and she has the cuff on and it's connected to her phone. And then you'll actually hold your arm up and it's sending all of these things to your phone. And if it detects that something's off about the your rhythm, your pulse or something, it will send that straight directly to your doctor and have those results there. So that was my poster, and that was kind of the main deliverable that I did during my internship. So kind of getting to the concluding side now of things, I have future avenues for perinatal research. And those are just, as I mentioned with that, the poster with hypertension, just investigating various trends. And that's just not with racial ethnic trends, but with class trends, environmental trends, rural, urban. It's just, it's so needed. And then I have right up under that is the public health focus, looking at the social determinants of health. I actually learned that in Randall's class we have with EHR. So that the social determinants of health are just so key in just treating the overall quality of a patient. And that's what medicine is moving towards, is more precise healthcare, but also in general, it's about treating the individual that you're seeing rather than treating for a certain condition. So then another thing is just, potentially implement a mock intervention, a mobile health app or something like that, that would allow us to actually see trends, being that we're here to do some research on site. So yeah, those are just some things that I had pointed out. And then right here, I just have some final thoughts. And I was very appreciative of the opportunity to cater my internship of the avenue of which I plan to use my degree. As I mentioned, coming from a health background and going, in a still similar health route, it's great to be able to do the research that I did and just kind of get your hands really on some research, get granular with it, not only just looking at hypertension, but looking at the demographics of it, who's suffering the most, looking at these trends and investigating them. So then you have precision healthcare, social determinants of health, public health. I kind of touched on those in the last slide. So those are still just important things that are concluding thoughts right here. And then wisdom. And at the bottom, we have a data pyramid. And I think that that's very important to put on a presentation such as this. But I think that what I've obtained at the beginning during those topic presentations is information. The data was already out there. Someone posted the data. I took it and I grabbed information. The stuff that I put on my poster, that's knowledge, that's wisdom. That's what goes to clinicians and shows them, okay, what can we do? Who's suffering the most? How can we treat these patients? How can we make sure that we are accounting for these patients that are coming from certain environments? So wisdom at the top of this pyramid is what healthcare is trying and needs to move towards. And it's a long process, but we're moving there. So very excited for that. And then just some last acknowledgements is just I wanted to thank Randall Blanco, my internship director, just for allowing me to do my internship with him. I had an EHR class with him during the fall semester of 2021 and ended up enrolling in his internship. And then the Perinatal Research Service Center for allowing me to do my internship up under them. My internship cohort peers for allowing me to meet with them and present my topics, discuss potential topics with them. And we would sometimes, use one person's topic as a starting point for the next person. So I would like to thank all of them. And then the CHIP program for allowing me to be here and present this topic to you all and be here today. So thank you all.